I had my first concussion probably around 6th grade, but I didn't know it was a concussion. I would just get really bad headaches. So as I continued playing high-level soccer, every time it got hit, it just got worse and worse and worse. About a year and a half ago, in January, I got a really bad, my brain just kind of gave up when I got a bad concussion.
Traditionally, concussions have been one of those things that for a long time were really just ignored. But now that we have so much better awareness of when somebody is concussed, we're in a much better position of knowing how to manage it afterwards. Many individuals, after they've had one concussion, most will heal within 2 to 3 weeks for the most part. But the highest percentage of reconcussions are within that 2 to 3 week period after an initial concussion. And with that second concussion, you can end up with some much bigger problems.
I've been dancing pretty much my whole life. I started dancing competitively around 6th grade. As a result of getting dropped on my head all the time, I've suffered from chronic migraines for about 5 years.
So I've been playing soccer for 11 years. I play center defense, which is just you kind of play right in front of the goalie. When she was coming out for a ball, she just didn't see me, and her hands came down on my head. I had headaches, nausea, dizziness, and my brain just felt really fatigued, I remember, and I was very tired.
Our approach to concussion rehab is to look at everybody as an individual, because you see one concussion, you've seen one concussion. Everybody's different, and what may work for one person is not going to necessarily work for another. Universally, we start with the cranial sacral therapy because it helps to calm down the central nervous system, relieve some of the fuzziness that is going on in their brains.
You know, you come into therapy with a horrible headache, and afterwards you feel super relaxed and you can finally go to sleep without waking up from a horrible headache, which is so true. I ask my mom for Cranial all the time. I'm like, Mom, my head hurts. Can I get Cranial?
The Biodex is a tool that we use to measure balance. It gives us some objective data so we can see how much sway an individual has with their eyes open and their eyes closed. And that gives us clues as to if it's more visual or vestibular in nature. It also is a great measure of improvement, and it gives excellent feedback to the patient about where their body is in space. If you tend to put all your weight forward, or if you tend to rock back on your heels, which we often will see with a concussion, then we can work with that and have immediate feedback as to where their body is centered over their feet. It's also nice because we've got games included in there where you can use some different programs, and then we can transfer that out into the clinic and then on the field with balance activities and improve functional performance.
In partnering, it's super important to know exactly where your center of gravity is, because you're relying on another person to be holding you up, but you also need to make sure that your center of gravity is perfect to prevent you from falling or them dropping you. The guy I always used to partner with, he would yell at us, but you're not on your center, that's why you'd fail. He would blame it on us.
The Dynavision is particularly important. The training itself really works to enhance somebody's peripheral vision, which is really critical in protecting them from falls and from further injury. The faster somebody's able to process those lights and hit those buttons, it actually correlates into their overall function outside of the clinic.
Everyone can tell because I used to run into stuff all the time and lose my balance, so now it's I can walk fine.
As soon as my therapists all figured out that I was having more trouble and missing the lights that were on the outer ring, which is indicates that I was having trouble with my peripheral vision, we started doing exercises that were focused centrally on that. My goalie, who was either really far to the right or left of me or behind me, it would have helped to have much better peripheral vision following my first concussion, at least, so I could have prevented future injuries that I've had.
For a lot of the kids that we see, they may have cognitive issues going on, so we can program in different words, equations, different complex tasks to do at the same time as they're working on the light board, and it really carries over to their everyday life.
I have daily exercises that I've improved on. My reaction time has already improved, which will help me in soccer a lot also when I return.
It helped me read, and now I can read, and I wasn't able to read for a year and a half.
Interactive Metronome is a great tool for attention and focus. It works on parallel coordination, attention, organization, and executive functioning. We're able to adapt it to whatever level of the patients. So we love using that tool to help with the auditory-based issues that many people have.
Since I started the interactive metronome, I slowly increased my times that I could, periods in which I can study, and I'm able to focus for longer periods of time.
You don't want to do too little and you don't want to do too much. And there's a just right challenge and just right level of activity that you want to tap into for every patient. What we want is to work the nervous system hard enough so that somebody feels it, but we don't want them to walk out of here feeling like they did too much.